Well, now to another story uncovered by CBC News. This one revealing a major medical mistake. More than 1,000 cancer patients may have received watered-down chemotherapy drugs. Our health reporter Kelly Crowe has the story.
I'm calling from the Cancer Center. I'm one of the
Hundreds of cancer patients are just now receiving the disturbing news that they were injected with an underdose of their chemotherapy drug.
The underdosage may be as little as 3% or as high as 20%.
The mistake happened at 4 cancer centers in Ontario, in Windsor, London, Oshawa, and Peterborough, and at one center in St. John, New Brunswick, affecting a total of about 1,000 patients.
The hospitals are offering them a rapid appointment with their oncologist to discuss the situation.
For an entire year, the 5 hospitals bought the drug from a single Ontario supplier, not realizing they were underdosing their patients, until a pharmacy technician at one hospital noticed something strange.
The bag that they were using, the solution that had been provided by the supplier, seemed to be a little bit larger than the other ones. And so through some inquiry and due diligence on their part, they felt that there was an issue, and then they notified us because they knew that we were also using it. And from there, we all commenced to try to investigate what was actually happening.
This is the exact sort of mini bag we're talking about. It was 250 mils.
The drug was mistakenly diluted because there was too much saline in the IV bag. But why was the bag too full?
That's the critical question here, I guess, and that's why we're investigating this more completely.
The 2 drugs, cyclophosphamide and gemcitabine, are part of a chemotherapy regime for breast and lung cancers, as well as lymphoma and leukemia.
It's a serious mistake has happened, and we're dealing with patients who were under treatment for cancer, so it is serious.
Oncologists say the impact will be different for every patient, but the main risk is that the treatment will be less effective.
But if you look at all the factors that are involved, the likelihood of this causing a significant diminishing effect of their chemotherapy regimen would be quite unlikely.
The premixed chemotherapy was produced by an Ontario company called Marchese Hospital Solutions, and late today the company issued a statement saying it's confident it met the quality specifications of its contract, adding it will have more to report in a few days. Kelly Crowe, CBC News, Toronto.